In today's To Your Well-Being, we want you to take a look at these numbers. 174,000, 31,000, and 2. Now here's why these numbers are significant.
The American Cancer Society estimates there will be more than 174,000 new cases of prostate cancer this year, and that more than 31,000 people will die from it in 2019. Now, because prostate cancer is the second leading cause of cancer death in U.S. men. But there is some good news. This diagnosis doesn't necessarily mean a death sentence.
Robin Bass is a prostate oncology nurse navigator with the Cone Health Cancer Center. Joins us live this evening with more information. First of all, Ms. Bass, prostate cancer, it is common, but it is treatable.
That's correct. Prostate cancer is the most common cancer in men other than skin cancer. Approximately 1 out of every 7 men will be diagnosed with prostate cancer in their lifetime. But if the prostate cancer is detected very early, it's very treatable and curable. It's when the cancer goes outside the prostate to other parts of the body that the cancer is called advanced cancer. It's harder to treat and is no longer curable.
So you talk about catching it early, and that's a big factor in all of this. So what are some things that men watching at home should know that could increase their risk of getting prostate cancer?
Aging. As the body ages, we're at a higher risk of developing cancers. African American men are at a higher risk and having a higher risk of having more aggressive cancers. And also a family history. If you have first-degree relatives, which would be a father, a brother, or an uncle with prostate cancer, that also increases your risk of prostate cancer.
When should men start getting their screenings, and really just talk about how simple the screening actually is?
All right, if a man has no risk factors, 50 years of age is the time for them to have a baseline called a PSA, which is a simple blood test that we draw. It just measures a protein that the prostate excretes into the blood. When you have cancer, the PSA elevates, but not always having an elevated PSA means cancer, so that's one reason to follow with your physicians. Also, if you're African American, your screening should begin at 45, or if you have a first-degree relative. If you're African American and have a first-degree relative, then around 40 should be your baseline PSA.
Okay, so really you have to know your family history,
right,
and also be very in touch with your doctor.
Yeah, a lot of risk factors to know about, and I know many of our viewers are African American, so you're hearing this, okay, maybe I could be affected by this, but those regular screenings will definitely help.
Right, so it's important to have a healthcare provider that follows you, knows your history, so if your PSA starts rising, they'll see it.
All righty. Well, thank you so much for joining us today and providing some insight.
Thank you so much for being here.
Thank you for having me.
Appreciate it. And Cone Health Systems have actually several free prostate cancer screenings coming up, including today in Reedsville and over the next few weeks in High Point as well as in Mebane.